This is your friendly neighborhood oncologist, Dr. Rajeev Vijayakumar. I'm a medical oncologist at BGS Global Hospital, Bangalore. What are we going to talk about today? We're going to talk about what foods to eat and to avoid during therapy for cancer. You might have heard a lot of people telling you, don't eat this food, eat this particular fruit, eat this, don't eat that. Actually, it doesn't matter. As long as you eat healthy, cooked, fresh food, that's all that matters. The most important entity over here is you need to maintain a good balanced diet, good amount of proteins, because you have a lot of muscle breakdown. So you need to have a good amount of protein. That doesn't mean that you only eat eggs and chicken and only soya. It doesn't work that way. You need to have a balanced. You need to have a good amount of fats, you need a good amount of carbohydrates, and yet a good amount of proteins as well. The balanced diet is the mantra over here. You might have heard people saying that do not eat these fruits. These are completely a no-no. Now, normally, when we are all in a healthy state physically, we would end up having 1 or 2 fruits or probably a bowl of fruits in a day, maximum. So we should continue only this quantity. We should not increase the quantity of fruits to a large level, eating half a kg of fruits. Let's not make it that way. Packs almost all of its products in the most nutritious and the most sterile manner. So, like even if you take a banana with its stalk well intact, when you open it, it's pristine, it's clean. You can consume that with not much of a problem. If you cut open a pomegranate, it's pristine inside. You just have to ensure that, see a visual inspection of the surface, that there are no bugs, there are no holes inside, that no bugs have entered inside. After you cut it, again do a visual inspection to see that the contents of the fruit inside are good and they are safe to consume. If that is there, you can consume that food. So the technique is you wash it well. Instead of 5 times, you wash it 10 times. Then afterwards, cut it with a clean knife. And if it's good inside, you can consume it. And consume it all at once. Don't keep it for over half an hour or 1 hour. So then there are chances that it can get contaminated. So the only mantra is that you should have fresh, cooked, roasted or fried food. That is, you can't fry your banana and apple. So those, if you want to eat those, you need to ensure that the fruit has a thick peel, like bananas, pomegranates. If you want to have apples, which cost 200 rupees per kg anyway these days, but even if you want to have apples, ensure that it's cleaned multiple times. Then afterwards you peel it twice rather than once. You peel it twice, you remove the core, so because that's where the bacteria sit. Then afterwards again wash it, then you can consume it. But again, consume only the quantities that you would when you were normal, that is without any chemotherapy. Friends, there's a lot of discussion about consumption of sugars during cancer therapy. Now, there are some articles which say that consumption of sugars would lead to an increase in the cancer multiplication because cancer cells would eat up the sugar. That it's true. But let us understand that whatever food we eat, proteins, carbohydrates or fats, all of them get converted into ATP. ATP is the currency of the cell. So once this gets converted, the body uses that particular currency for the normal functioning of the cell. Hence, everything in moderation is good. You do not cut away your carbohydrates completely. There have been large number of trials which have said that doing only a keto diet is useful and a non-keto diet is harmful for the body. But we know that our patients, if we are able to get them eat a full meal, that is the biggest challenge and the biggest. But we know that if we are able to get our patients to have a complete meal without skipping any of the contents, that itself is a big success for all of us. So therefore, do not try to split hair in trying to identify which foods to eat or not. Whatever food is cooked at home for the rest of the family, you can consume that happily. Just the Mula mantra is that Taza Paka Hua Garam Khana. Again, Taza Paka Hua Garam Khana. Of course, you don't boil your curds. So you can have that fresh curds, fresh well set fresh curds, you can have that as well. That's very good for the gut. Thank you. If you like this video, please do give us a thumbs up and then after press the subscribe button and share this video to your friends and family. Thank you. Bye-bye.